We appreciate you making time to be here and for listening in with us during today's session. Forging partnerships and finding resources to promote worker health is our focus for today, and we're excited to have the National Center for Farmworker Health here with us in the form of Matt and Lisbeth, who will be presenting during our content time today. Before we begin, I have a couple housekeeping things I'd like to review with you. Will be your moderator. I'll be here in the background throughout the webinar. If you have any questions or need any assistance, please feel free to either send me a chat message. We can also use the chat for questions. If you'd like to ask something of our presenters, we'd encourage you to send those in. You can use either the chat or the Q&A, and you'll see those in that menu, in the Zoom menu for you. We do also have Spanish interpretation available today. We have a really fabulous interpreter who is here to help support those of you who would prefer to listen in Spanish. A little bit about AgriSafe. I am one of a really tiny but mighty team. We are working at making sure that we're paying attention to the occupational health needs of the people who are doing the work of agriculture. We have several different things happening right now, as I'm sure many of you are aware. We're continuing to pay attention to COVID-19 and its impact on the agricultural community. We do have a social media toolkit with some interesting graphics and other pieces that you can pull and use either on your social media websites or in print. Updates continue as the situation changes, so I'd encourage you to check back. If you've been there in the past, come back for more information. It's available from our agrisafe.org website, a pretty easy, quick and easy way to get to that material if that's helpful. We also have a podcast that's, we've had 3 sessions now. You can check out the different topics that we have available via podcast, and these are geared specifically toward agricultural producers. So we have you see Carrie here. Carrie is the voice behind the podcast, asking some really great questions from the people who are presenting. I think the most recent one due to release will be about anhydrous ammonia. So you can come in and check that out as well. We will be recording today's session, and we will put that in the AgriSafe Learning Lab. It is our kind of online storage space for trainings. There are lots and lots of different trainings available to you, and almost all of them are free and open to the public. You do have to set up a profile, but again, that's free. We just ask for your name and email address so we can prove to our funders that real people are using our stuff. Again, that's learning.agrisafe.org. The National Center for Farmworker Health will also have a recording available too, so you can come to either place if you want to come back and review the materials from today. I have a quick polling question to put in front of you before we move too much further, just to get a feel for where people are right now. So you'll see a polling question in front of you, and if you would respond to that quick, we'll just leave it up for a little bit, and then we'll move in to the rest of our content. All right, it looks like most of you have had a chance to respond. Always, as soon as I say that, somebody else puts an answer in. So thank you very much for responding to that. All right. Without further ado, the reason we're here today is to hear from Lisbeth Gall. She is the Health Education Coordinator at the National Center for Farmworker Health. Lisbeth is a native of Guatemala, has over 11 years of experience working internationally and in the US on health, education, and social programs with marginalized populations. She holds a bachelor's degree in social work with a focus in development management and a master's degree in international training and education from American University. She currently works for the National Center for Farmworker Health as the Health Education Coordinator. She is responsible for supporting health communication interventions to influence behavior and improve health by developing health education resources using social marketing methods, providing training and technical support to constituents. She currently lives with her family in Durham, North Carolina. So thank you and welcome to you, Lisbeth. And we also have Matt Solberg. Matt is the Agricultural Employer Engagement Coordinator at NCFH. Matt works to connect agricultural employers and labor contractors in the United States with public health resources in their area. He has worked with employers of all sizes to coordinate COVID vaccine clinics for their workers, connect them with health centers for other worker health issues. As a student at the University of Vermont, he studied agricultural economics and volunteered with migrant workers in the dairy industry. Matt is committed to helping employers utilize public health resources available to their workers without interrupting work schedules. All right, I'm going to stop sharing my screen and turn it over to our first presenter.
Yes, hello everyone. Thank you, Stacy, for the nice introductions. I'm going to start sharing my screen. And we're going to be working off of a slideshow here, but I promise it won't be too boring of a slideshow. We're going to navigate into some web links as well to show you NCFH's website and some other useful tools. So again, just that's me and my colleague, Lisbeth. And I wanted to start by giving a background about NCFH and some of the other work that we do. So we're a nonprofit organization. We're based in Buda, Texas. It's pronounced Buda, not Buddha, which is just outside of Austin. But we do work nationally. We work with a network of health centers all across the country in almost all 50 states. And we make population-specific data resources, and we provide technical assistance to those health centers, as well as over so we work with health centers, but we also work with employers. We work with other community-based organizations, and some of my colleagues, they make these good data about migration pathways of farm workers, where they're coming from, if they're coming from Mexico or Central America, and the different stops that they make in their seasonal work schedules in the United States. And then lastly, what we'll be talking a lot about today is the health education resources that NCFH has made. So we have a team of about 20 people, some of whom are working on just making flyers, posters, videos, audio files that, that communicate information about health topics, a lot about COVID-19, which we'll talk about in this presentation, that they're reviewed by the CDC. And we've seen success when we give these to employers, that employers can give to their workers to try to implement in parts of training or orientation sessions with workers. So how we can help employers, and this is basically what I do in my job on a week-to-week basis. So contacting health departments or health centers for employers to try to set up, a lot of what we've done in the past year is setting up COVID education sessions or COVID vaccine pop-up clinics on farms. And I like to tell employers that I can wait on hold for you when you're contacting the health department, because we all know that whether you're trying to get something out of your local bureaucracy or whether you're calling a company's customer service hotline, it's annoying to wait on hold and you have to call back and you have to leave a message here. But I enjoy doing that, honestly, especially when it's trying to utilize public health resources for COVID. So that's kind of what I market myself as to employers, identifying language needs among workers. So a lot of times employers, they know that where their workers are from generally. Say it's an H-2A employer and he knows that every year for the harvest, his guys come from Mexico. He might know that and assume that they speak Spanish, and most of them probably do speak Spanish, but we're seeing more and more that workers who are coming from Mexico or Central American countries speak indigenous languages. And a lot of times employers or their kind of crew leaders might not realize that. So NCFH has that expertise, and we can help you identify the languages that your workers might speak, and then provide you with appropriate resources for those workers. Again, audio files, videos, and flyers and posters that employers can easily utilize. And like I already mentioned, coordinating health education sessions, a lot around COVID, but we also do stuff beyond COVID, like around flu and other infectious or chronic diseases. So the three learning objectives for our presentation today, I'm going to talk about the first two, and then my great colleague Lisbeth will talk about the third one. We're going to talk about two common health-related issues faced by migrant and seasonal farm workers in the US. Those are going to be diabetes and COVID. And then we're going to talk about how to locate and identify your local health department or health centers or really any other public health entity that might be able to come onto your farm and provide educational sessions or provide COVID vaccines or COVID testing. Because what we've seen a lot is during the pandemic, health departments and health centers and all these other public health entities, they're eager to try to get out and serve these marginalized populations. They're having these strategy meetings about how can we reach people in rural areas? How can we make sure that they have access to these resources? And as much as all these people and all these organizations and institutions have been trying to reach workers, sometimes this extra outreach and just promotion is necessary for employers. So that's what I'm going to demo 2 maps and how to locate that. Okay, so the 2 health issues, like I said, we're going to talk about are diabetes and COVID-19. So first, talking about diabetes, NCFH has made this good fact sheet outlining what the big things that people need to remember, specifically employers need to keep in mind about diabetes and its prevalence among workers. So I'm going to exit the slideshow and navigate to the fact sheet. And I'm also going to share this link in the chat. So if people want to navigate to it on their own computers, feel free. So again, this is a fact sheet that NCFH has made. At the top, we give some background information on what diabetes is and what it looks like, how it's related to diet in some ways, and some other background information about its prevalence in the United States population in general, and then also among specifically agricultural workers. The first thing I wanted to identify in this fact sheet that I think is important for employers to remember about their workers is diabetes, and it's linked to diet and access to nutritious foods. So this first bullet point under environmental, social, and cultural risk factors, which are commonly known as social determinants of health. We found this research based out of North Carolina, where approximately 20% of workers reported food security issues. Half of all lunches and a quarter of all dinners were obtained pre-prepared from vendors. And how does that relate to employers? Well, we know a lot of times that in a long day in the fields, the most efficient way of getting lunch to the guys is having a food truck or some other sort of catered food brought on site so that workers don't have to spend time going into town to get food. And a lot of times that food tastes good, it's efficient, they only have to spend 30 or 45 minutes eating. But if that becomes a consistent pattern, and that's what the employer falls or kind of defaults to providing lunch every day, then the employer might want to consider offering other options for lunch or getting worker feedback on if they wanted to get other sorts of food options. And again, we know that employers aren't going to prioritize, having the most healthy salad available if that comes at the expense of work time, but it's still something important to keep in mind, a small step that an employer can take to try to mitigate a potential thing that might be damaging to workers with diabetes. Other things I wanted to highlight in this in our fact sheet, some risks for workers who have diabetes or might be at risk of developing diabetes is their migratory lifestyle. So again, let's say a worker is coming from Mexico, comes to the US for 3 or 4 months. They might have a diabetes management plan with their health provider back in Mexico, but when they come to the United States, that gets interrupted. Their channels of communication with their health provider get interrupted, their access to medicine. So that's something that the employer should keep in mind. And then the other big thing with these last 3 bullets kind of talk about is the limited clinic hours and concerns over lost wages or just losing work in general. We know that for both employers and employees, the primary goal is to get as much done, to work as much as possible, to be efficient. And we know that neither party is going to want to prioritize a potential health issue that they might have, diabetes, if it comes at the expense of losing several hours of work. That trade-off just sometimes it doesn't make sense. But if the employer can take some small steps towards mitigating that or offering basic services or information to workers, that could be a prudent and wise investment. And so what's the primary thing that NCFH has seen in terms of employers trying to mitigate diabetes and taking an easy step? The big thing that I want to highlight right here, I'm literally highlighting it in blue, is inviting community health workers, in this case specifically Latino community health workers, if your workforce is mostly Latino, to come onto the farm and just give an education session to the workers, talk to them in person, have that individual FaceTime, and be able to screen workers for signs of diabetes, talk to them about their diet, answer any questions they have. And we've seen that this is going to be something that I'm going to talk about with COVID too, and just in general. We think that it's a successful practice by employers to invite a professional, whether that's a nurse or a doctor or a community health worker who might not have formal medical training, but can still come and is an expert at communicating and knowing the right questions to ask, knowing the right resources to recommend. That's the biggest step that an employer can take towards, and it's usually good at the beginning of the season to be able to do that, inviting that professional on. Another thing that an employer can do, if you're providing the housing and the living arrangements for workers, as H-2A employers have to do, is putting up flyers talking about diet and healthy eating in the common areas or in the kitchen areas for your workers. So I'm going to navigate to another page on NCFH's website, which is our health education resources and our diabetes resource hub. And this is a collection of useful flyers that anybody can utilize, not just employers, about diabetes and the signs of it, pre-diabetes, etc. But we're going to navigate down to the bottom, to the healthy eating tab down here. And you can see that these flyers in English and Spanish talking about just a healthy diet and easy tips that people, or easy things that people can do to try to mitigate that. And I know that sounds like that NCFH is telling the employers to act like their parents and tell the workers to eat their vegetables, but that's not what we're doing. It's just a small step that employers can take to add that extra information. So I'm going to navigate back to my slides. Again, diabetes, what can employers do? Host that expert on farm to talk to the workers, ideally at the beginning of the season. And NCFH, I want to highlight to all employers who might be watching, NCFH can help you coordinate that. We have those relationships with health centers. I like waiting on hold and trying to organize health professionals to come onto your site, putting up flyers and posters in the kitchen area, telling their workers to eat their vegetables. Just kidding, haha. Okay, now we'll talk about COVID. And I want to stop and add that I know that there's in the audience, there's a lot of health educators and health education professionals in the audience. So if anybody has any questions or comments about this, feel free to text them in real time in the chat. There's also going to be a Q&A session at the end. But if anybody has any ideas on this, please feel free to share. But talking about COVID, we know that most people in this audience, I imagine, know the risk factors among agricultural workers and how they have a higher risk of COVID because of their housing and transportation arrangements. A lot of times can't allow for social distancing, the language and literacy barriers, and worries about immigration status, kind of creating that sense of fear where the workers don't want to go out in public to try to utilize something where they might have to show documentation. But I think the big thing to highlight for employers among these risks is the language and the literacy barriers. Again, an employer might not know that their workers speak a language besides Spanish as their primary language and be giving them information in Spanish and not realizing that the worker might not be able to internalize all that information to the fullest extent. So what can employers do to related to COVID? At this stage in the pandemic, it's arguably becoming endemic when workers are coming back to start the season, starting up in a few months, or in the West Coast, I think in California, the season's already starting. But what can workers do at this, or what can employers do at this point to encourage COVID safety and COVID vaccines or boosters among their workers is sharing key messages with employees through posters or emails or other channels. And again, we're going to show you some of the flyers and posters that NCFH has made that employers can utilize easily, and remind workers at the start of the season that vaccines and boosters are available for free in the United States, regardless of immigration status. I think this is especially pertinent to H-2A employers where they know that their workers are coming from a foreign country and There's some regulations that are tied into this where we would encourage employers to, consult with their lawyer or some other expert legal advice about compliance, because there's the vaccine, the requirement by the Department of Homeland Security to be vaccinated before you cross the border, which is impacting H-2A workers and their access to vaccines, or just generally what they're thinking about vaccines. But again, it's always safe and it's good practice at this point for the employer to just remind workers that if they are due for a booster shot, or if they're not vaccinated, or any sort of questions, just reminding them that information is available and resources are available. But again, the best thing that an employer can do is hosting someone on their property, either from a health department or a health center, to be able to talk to workers. And again, having that be culturally appropriate. So if your workforce is mostly from Mexico, then it would be good to have someone who speaks, who's who can relate to them culturally and communicate in the appropriate language. And again, identifying and fostering partnerships with your local health departments to be able to come on site to give those talks. And so, okay, well, this is an example of a flyer that NCFH made that we've passed this out to several employers, and they've put it up in common areas. And on the left side is English, on the right is Spanish. We also have this available in several other languages that Lisbeth will show more of for her part of the presentation in a little bit. But this is just an example of a kind of like the diabetes flyers, something that an employer can easily print out, put up in a common area. And if workers ever have any questions about it, then they can feel free to ask. The employer can incorporate it into the orientation or training at the beginning of a season. So, like at the last bullet point in that other slide, how would you go about connecting with and trying to forge a partnership with your local health department to come on site and give some COVID education? Obviously, you can Google it wherever you are in the country. You can just type in your county and health department. But I wanted to show you all this other link that NCFH has found that's a good kind of centralized database of all local and county health departments in the United States. So I'm going to exit the slide again and navigate to this website. And again, I'm going to share this link with you all. Or actually, let me go to the I'm going to go to the actual directory first and then share that link. And I see Catherine's question in the chat about resources in Washington State. And yes, we will follow up with you, Catherine, about resources in Washington State. And maybe perhaps you can, when I share this link with you all, I encourage you to find what resources are in your state or area. So again, this is just a map. Catherine's from Washington. Let's click on Washington. We'll click on Washington. Excuse me. Click on it, and then you just scroll down a little bit. It takes a little bit to load, but then here it has all the county health departments in the state of Washington and their contact information. You can look at it in this grid form, or you can view it as a list. And again, it has these easy links to email or to visit the website or to call them. And again, it's in alphabetical order. So that's something that it's a little bit just easy to see county by county. Another thing I want to highlight on this website is they have the same information, but specifically for COVID resources from county health departments. So I encourage you all to go to the search box up top and type in COVID directory. And this is going to give information about the COVID pages and COVID resources specifically in each county. There are some caveats to using this depending on how your state Department of Health operates. These links might take you to just the state Department of Health's website. They might take you to a regional, like a region within the state. I think in Georgia, they have those where they're kind of collections of county health departments. But so this takes you to a PDF file that's interactive, where you can scroll to any state and see what their COVID resources are. So let's try North Carolina. Where's North Carolina? Down here. You can click on page 129. And again, it shows you in this list format the different county health departments in North Carolina and links to the relevant COVID-19 web pages. And so employers can utilize this to just get straight to the website that they need to look at to find COVID-19 information. But again, we like doing this on behalf of employers or on behalf of anybody really. So if the employer ever has any questions, we can just come to us and we can navigate this for you. So that's the Nacho tool. It's a fun acronym to say. And now talking about health centers, and again, NCFH works with a big national network of health centers. That's what NCFH has done for most of its existence, is partner and give training to health centers about how to better reach agricultural workers, migrant and seasonal agricultural workers in the US. And again, I know that a lot of people on this webinar are health and safety professionals, so you probably don't need a reminder about the health center program, but they're private entities who get funding from the federal government in order to provide low or no cost healthcare services, specifically primary care services in their area. Most of them have mobile units where they can come onto a farm or to a housing site to be able to deliver, let's say, a diabetes health or a diabetes educational session or dental work. We've seen sometimes health centers having mobile dental units where they can give basic checkups to people who haven't seen a dentist in a while. They're also called community or migrant health centers oftentimes. And these, there are three other kind of subsects of populations that health centers serve. They get funding to serve a specific population segment. So there's one for migrant and seasonal agricultural workers that I'm talking about here, migrant health centers. There's some that serve veterans. There are some that serve people experiencing homelessness, and then there are some that serve people who live in. But for the sake of this conversation, we're going to be talking about the migrant health centers. So how would an employer go about finding and then locating their migrant health center that's in their area? So again, I'm going to exit my slides and navigate to some cool maps that we have. One is made by the Department of Health and Human Services, and that shows, we're going to navigate to that one first. And again, I will drop this link in here for all of you all. Okay, so I hope everybody can see this map. Let's say we want to search for Texas and migrant or any health center, because again, this tool is going to show you all health centers, not just migrant health centers in Texas. So we search, we wait for the results to come back, and we're only getting three results right now, or 4 results. Well, that can't be right because Texas is a huge state. And you know what's wrong is that we need to increase our mileage range. So we'll go down here and go to the biggest mileage range possible, 250. Click that, wait for it to reload. Okay, so now you see all the health centers in the state of Texas. But again, these could be health centers that might not serve migrant workers, but they might serve veterans or people experiencing homelessness. So I just wanted to show you all this because it could be helpful. But now onto the map that shows specifically where the migrant health centers are. So NCFH, my good colleagues who are data and software wizards, have made a map that uses that same information from the Health and Human Services Department, but showing specifically where migrant health centers are. Let me share this link with you all in the chat. Oh man, Stacy, I'm realizing I was sending the link to just the hosts and panelists.
That's okay, I got you back. You're good,
yes.
You're fine.
Yes, okay, well, I just sent that one to everyone. So this is on NCFH's website, and this is a map of all the specifically migrant health centers. So should we go back to Washington maybe and see, Catherine, what migrant health centers are in the state of Washington? So let me actually give some background on this map. You can just go and kind of zoom in on, like try to zoom in, but it's sometimes a little hard to handle. So the best way to use this map is to just search up here in the top left, search your state. So we'll search for Washington. And then you can zoom out a little bit here to get the full view of the state. And the way health centers work is a lot of times there are networks of health centers that have the same name. A lot of times they have family or community in their names. So example, family health centers, family health centers, family health centers, but they're in different locations. So employers can utilize this to, they can utilize this map to find the health center that's closest to them. And then they would have to find the contact information for these health centers, you would have to open a new tab. Unfortunately, you can, like the link here doesn't go straight to the website of the health center, but you can see the name of it, Family Health Centers in Twisp, Washington. You can go navigate to a new tab, type that in, and then it would take you to their website. And then from there, the contact us button is usually pretty easy to find for employers. So those are the two health center maps. And again, I hope that employers will be able to utilize this well, but I know that most of the people in the audience right now are kind of health and safety professionals or educators. So I hope that if you didn't know about these maps, that it might be able to maybe allow you to provide some more information to employers or workers that you work with. And that's it for my part of the presentation. I will be turning it over to Lisbeth, but first I wanted to ask a polling question here, which was, as I stop sharing my screen, if Stacy could ask the question about languages and what, for any employers in the audience, what languages are spoken by your workers? Thank you, Anna. That link, I'm going to navigate to it now. And I know that for this poll, there are only a few employers in the audience, but it would still be relevant. But thank you all for your time, and I'll turn it over to Lisbeth now for her part of the presentation, talking about how to utilize NCFH's multilingual health materials.
Thank you so much, Matt, for the great presentation and for all of the resources you presented today. And thanks also for the questions that are coming in. Yeah, so while I share my screen, I would like to ask Stacy again to share the next polling question. It says, what sources of information do you utilize when trying to find the educational resources for your workers? And we're gonna take a few seconds. If you could share what do you usually do when trying to find those resources?
It looks like most people have had a chance to respond now, Lisbeth. Would you like to
Okay.
see the results?
Yes, yes,
Yeah?
please. Yes, thank you. Thank you, Stacy. Yes, let's see. Okay, so first it says CDC, WHO, health departments, so universities, websites, anything I find on Google or social media, others, none. Perfect, well, 80%. Some of the most reliable sources that we have, and of course, yeah, there's a lot out there, and today I would like to discuss a little bit about the resources that we have, and of course share some basic considerations on how to find culturally and linguistically appropriate health education resources. And so thanks all for sharing. And I'm seeing here a comment on languages too. Janet shared that one of the languages that workers she works with speak Burmese, Spanish, Creole, and French. So that's great. We're gonna use this information. So thank you for participating. So we want to start talking about why do we need to find culturally and linguistically appropriate health education materials. And well, this is to communicate relevant information to farm workers in an effective way and in a way that demonstrates understanding and respect for their culture, race, and ethnicity. And we all know that they come from different backgrounds, and of course we want to show compassion and understanding for people with diverse backgrounds as well. And so how to do this? First, it's necessary to know your audience. Two, it's necessary to identify the preferred mediums of communication. What are you going to do in that situation when you want to share information? And three, assess and select the best educational resource that better fits your audience. So NCFH found in 2020, this is taken from one of the fact sheets that we have on our webpage as well, so you can see more information. But in general terms, when we talk about farm workers in the United States, we know that the majority of them are foreign born, coming from Mexico, Central America, and other countries. The majority of them self-identify as Hispanic. About 68% of them are of crop workers were male, and 32% were female in this study. And the majority are most comfortable conversing in Spanish. And like you said, perhaps many of them speak another indigenous language, that they may know Spanish as a second language as well. And farm workers have an average age of 38 years. So you can find on our webpage, we have more information about that, indigenous languages as well. And so this is why it is important to understand, the general profile of a farm worker. But when you're working in your community, in your state, and in the region where you are, you will see throughout the year that maybe, especially if you work with seasonal workers, that they, demographics may be changing, and it is very important to have that understanding whenever you're trying to find educational materials, so that they are more relevant to them. So these are the three aspects that we want to see. We want to understand what's their age, their gender, their language, their culture, if they belong to a specific ethnic group, and of course the literacy levels, because this makes the difference as well. If they cannot read well, and especially coming from other countries, they may have high illiteracy levels as well. And so understanding that limits the type of material that you are going to find for them. And if you're if you know what is the how you're going to share this information, then you have to think about, well, am I going to share this information in person? I'm going to use social media, chat apps, text messages, or radio. And that is going to help you identify what is the type of resource that you need. If it's written, if you need a flyer to do an on-site visit, or if you have a group of people on social media, well, then you may need multimedia materials. So these are just a few basic considerations. At NCFH, we produce resources on different health topics, and we have a webpage on COVID resources as well. But we also have a national inventory with all types of resources related to COVID and from different states and everything. And what we use when we try to identify materials that are relevant on different topics, we use this assessment, and I'm going to share this link with you today. I'm going to share this in the chat. Let me see. I'm going to share this in the chat, and you can see, you can find this resource in English and in Spanish. And so this assessment form can just tell you a little bit of information about what do you need to consider whenever looking for a material that is going to be fit for your audience. And so we have 4 main sections here, and again, it's available in English and Spanish. So basically, what we have in the first section is seeing the general content. Are the objectives clear in the material that you're looking at? Is it current or is outdated information? Especially now during COVID, we see that guidelines continuously change. And so we need to have the resource that has the most up-to-date information. How is the writing style and the text construction? That the words are simple, they are not very long, that the graphs are simple as well, that it is written at or below 6th grade, that this is kind of the limit that we have in terms of literacy. And in organization and text appearance, is it organized in bulleted lists that has simple illustrations and fonts? And of course, the cultural and linguistic appropriateness is the content appropriate for the target audience. It doesn't use images that are going to be in a way not culturally appropriate, that is not representing diverse groups. And so that it also acknowledges different practices and beliefs that people may have around health. And then this is the website where you can find educational resources for COVID. And I'm going to again share this link with you here so you can navigate here if you like. So here you can find the assessment checklist that we use in English and Spanish, and you can see the collection of materials that we have produced in partnerships with other organizations. Most of the materials that we have here are in Spanish, but some of them are available in English, as you can see, and you can scroll down and you can see that they're organized in different topics. This is about vaccines. We also have videos that we have produced. We have some testimonials, and we also have a few PSAs, a public services announcements if you need them. We work in partnership with other radios as well. And so we have a long list of materials here, and we update them on a regular basis. And then we have materials in Mexican indigenous languages. Here we have in Mixteco, materials in Purepecha, etc. And then we have Central American indigenous languages here. We try to translate all these resources, and of course we have the audio files of some of these resources as well, and in Haitian Creole. So this is something that you can definitely utilize. I see. Yeah, I think we're going to share all the links, and I think that we are going to also share our slides, so you don't have to yeah, save all of the links on your own, because I know that we've shared many links today, but I think we're going to compile them today just to respond to the question we have from Marilu. And yeah, then we have another hub of resources here that is about other topics around health that we have, and you can find them here in alphabetical order. So there are many resources that we have on our webpage, on our website, that, as you saw today, Matt shared a few. We have our fact sheets, and we have all these materials on different topics, and that we have the diabetes hub as well, as he presented. Yes, and so, like you said, I mean, there are many other sources of information, you know, besides the official ones that we have. But if you want to find other specific ones around for special populations, then you can always cite our webpage. You can cite AgriSafe, and here are other others that you can use. And we have also some organizations listed here that also have resources in indigenous languages. And lastly, one great resource that the National Center for Farmworker Health has is a program that is specifically for farm workers and their families. It's called Call for Health. And so this program provides assistance to different services around resources, referrals, interpretation, and other type of help for farm workers. Like I think Matt mentioned at the beginning, for example, sometimes farm workers need to get a test, so they can call to this line for free, and they can receive that support in Spanish, or staff is bilingual, and so they can even see how to schedule you know, an appointment to get their vaccine, and arrange transportation, and even get other type of service related to healthcare that is not related to COVID, for example. And so we have the phone numbers here, and they can contact us via WhatsApp, and these are the links for our Facebook and Instagram. And so these are resources specifically for farm workers and their families. And so they can call here, and if you didn't know about this program, yeah, this is something that we have. It's a great resource. And yeah, we also have our newsletter, and a newsletter specifically on COVID resources that we send every 2 weeks. So you can also sign up for this, and we're gonna be sharing all these links with you after the presentation. But yeah, there are many resources here that we hope that you find them very useful for you. So thank you for your presentation, and I think that we have a few minutes left for Q&A. I'm gonna stop sharing my screen now. I think I see a question here from Catherine. What areas are these resources available to? Is it nationwide or specific to certain states? Yeah, we have these resources available on our webpage for all of the country, and especially if you're referring to Call for Health, yes, it's for any state that the people are, and this is the specialty that our staff has, that they can help out people that it doesn't matter where they are in the country. Thank you.
We welcome your further questions. You can submit them either through the chat or Q&A. You can also reach out to any of us after today's webinar if you'd like to follow up on something specific to your scenario or the location of where you are. I know we can handle some of those things outside of here if you're more comfortable with that direct communication.
Well, speaking of questions, Stacy, there's a poll question that I forgot to ask. And Stephanie, yes, we'll be sharing our email addresses with you all. Stacy, could we ask the second poll question about distance from pharmacies, driving wise?
Absolutely. I just opened it up.
Great. I wanted to get a sense of how close the nearest pharmacy is to people, and basically like how accessible a COVID vaccine is for people in the audience right now. Because that would inform, or knowing how close an employer is to their local pharmacy would be a big factor in knowing if they wanted to set up a booster clinic, let's say, for booster shots for their workers. Would it make more sense to ferry the workers and kind of in groups to the nearest pharmacy? If it's less than 30 minutes or 20 minutes away, that might be the easiest thing. But if they're an hour away from their local pharmacy, thank you, Rose, for the compliment. If they're in a really rural area, then it might make more sense to host an on-site vaccine clinic through the health department. And so that's something that we we just try to have informed. Could we get the results from the poll, Stacy? Okay, so the majority of you are less than a 20-minute drive from the local pharmacy. 20 to 60 minutes, about 30%. Well, that's interesting. I think if this were mostly employers in this audience, it would look more like in the 20 to 60 minute range, or even more than 60 minutes away from a pharmacy. But for all the people in the audience who are health educators or who work with employers, that's the main factor. Kind of is the time lost for employers if they want to offer. If they want to offer boosters to their workers, either going into town or hosting it on-site. And thank you everyone for your participation. Yeah, and we'll be sending out a follow-up email. And Anna makes a good point in the chat about documents that people are going to expected to fill out when getting the vaccine, because yeah, sometimes they're in English and it's a little confusing. That's something though that the program Call for Health, or Una Voz para la Salud, that's something that we can do, is help with real-time translating. For if workers can't understand something, they can call this hotline and we can translate in real time. So if people are interested in some of these key cards, or the phone number for the hotline, to pass out to individual workers that you might interact with, or to pass out to employers that you might know, feel free to email either Lisbeth or I, and we can get you that information.
I know your team is in the background sourcing some of these answers for the questions. So if you do have access to a phone number, you're welcome to share that in the chat box. There we go. And that email is always, or that URL is always helpful. There we go. The Call for Health phone number. Man, we ask and all these things just appear. So thank you to to the team behind us that's making sure that the questions all get answered too. All right, I think we have made it through all the questions that have come in so far. Again, I'd encourage any of you who want to have further on conversation to reach out. If it's not an AgriSafe question, I'm still happy to connect you with Matt and Lisbeth and the team at the National Center for Farmworker Health. So we're really grateful for your participation. Thank you again to Lisbeth and Matt for presenting. And let us know if we can help you any further. Enjoy the rest of your day, everyone. Thank you.